Julie Lackman, naturopathic doctor. Do you know what to say when somebody calls you as a prospective patient? Do you know what not to say? These aren't really things we're taught in school, and you may not have seen a lot of front desk interactions when you're doing your clinical rotations. Wouldn't it be nice to know what to say, how to say it, and how to respond to certain people with certain questions? Like, how much does your service cost? How much is a new appointment? How much do I have to buy, if anything? They usually don't ask that. How about, do you take insurance? Can I use my HSA? These are all questions that were not taught in school, and by answering them correctly, you can book your new patients. Why? Because they're calling because they have a problem. They think you might be able to help, and what you have to do is show them that you are the solution to their problem, which in most cases you will be. So what we want to do is not say a price up front. We want to build the value of your service, because once they have the value, they will crowdfund. They will put it on a credit card. They will ask their parents. They'll do whatever they need to do to get that product, which is your service, for themselves. Because if they know that what you do is going to help them, they will do anything they need to do. I do have somebody who's crowdfunding, or she put up something, and she's Portuguese, and all the Portuguese people in her town supported her to come see me. And so finances are not an obstacle. People will do what they need to do to get themselves or their child the care that they need. And so what I want to do with you guys is to drill these things. I can't just give you a script or some words or some ideas and have you be competent. Just like you wouldn't do one, heart exam and think you know all the heart tones, or do one manipulation and think you have it, under control. You want that muscle memory in your hands, right? For those adjustments. And so the same thing, you want that muscle memory in your brain, which is not really muscle, but it learns. You want that memory so that when people call, you already know what you're going to say. If they say this, here's how you're going to respond. You want to know how to handle objections. And that's a big thing. Well, I read on Google that whatever, because they're going to say that. And I don't know if you can compete with Dr. Google or not. I struggle with that myself. But you want to have some things that you can say, like, well, I had this tested, I know, and here's what they missed. And people like that. They appreciate that you're taking a fresh look and you're looking at things that nobody's looked at before. And that's probably why they're not better, right? So what I want you to do is I want you to sign up for these training sessions, which are really drilling. We're going to drill you. We're going to single you out. Myself, my office manager, whoever's on the call that day, is going to single you out and ask you questions and have you be the new doc and she be the unruly patient or prospective patient. Not unruly, the questioning, or be a better way to say it. Someone who wants to come in but might have some reservations. And so you're going to learn how to answer those questions and get the person in so they can get better. And that's what this is all about. But you can't just read a script or suggested wording and think you know how to do it. Well, you really need to practice. Think of it like going to the gym to get better at something. So please take a look at this. I hope to see you guys all on the calls.